Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. Today, I'm joined by a physician, leader, and passionate lifelong learner, Dr. Anu Oyetoran. She's currently serving as Chief Medical Resident at the University of Central Florida College of Medicine, where she's also completing her internal medicine residency. But what truly stands out about Dr. Oyetoran isn't just her title or her clinical expertise. It's her deep-rooted drive to grow, inspire, and uplift those around her. In this episode, she takes us on a journey that spans continents, from Nigeria to Canada, the Caribbean, New York, and now Florida, sharing how each move shaped her resilience and her adaptability. She opens up about the challenges of medical training, the transformational experience of intern year, and her unmatched excitement about what's next, a fellowship in hematology and oncology. We also dive into her creative side as the voice behind Journey to MD, her YouTube channel, which offers transparent and encouraging guidance to aspiring medical professionals. And she shares how her family, faith, and calling to be a light during some of life's darkest moments have fueled her passion to serve, lead, and one day contribute to the cure for cancer. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Dr. Anu Oyetoran. Hi, Dr. Oyetoran. Thank you so much for joining us on this podcast. Before we even get started, full disclosure, I met her when she rotated through our office. So I know you personally, and what a presence you are. I remember the first time I even saw you and watched you interact with my colleagues. I thought to myself, oh my gosh, I have got to have her on the podcast. So this is like a dream come true. Thank you so much for joining us today.
Oh, wow, that's so sweet. Thank you for saying that. Hi, Ashley. I'm glad to be here. Thank you for inviting me.
You have such an amazing journey from the very beginning, and where you're going after this is just going to be incredible. We have so many fun things to talk about. When that happens, I usually think it's great to just start at the beginning. So take us way back and tell us a little bit about what inspired you initially to consider a career in medicine.
Yeah, I've always known that I wanted to go into medicine. For me, it really was when I was maybe 7 or 8. And what happened was my best friend at the time said she wanted to become a pediatrician. And so therefore, because she's my best friend, I also decided I wanted to become a pediatrician as well. But that was childish. And as I grew older, I started leaning more into the sciences, the biology. I enjoyed anatomy, all of these aspects of it. And so that just became clearer for me. It wasn't just because my childhood best friend had said it. So I was very clear on medicine becoming it. I'm also, full disclosure, I'm Nigerian, which is in West Africa. And so once you say to your parents that you want to become a physician, they hold you to it. They don't force you, they don't push you. At least my parents didn't. There's some people who that's their story, but that's not mine. But they definitely encouraged me, and they were a huge part of why I was able to achieve this dream of mine. And through high school, I moved actually from Nigeria to Canada in high school. And basically still realized that the passion was still there, even though I had changed environments and whatnot. And I, even throughout high school, towards the end of high school, my mom found this school called St. George's University, and it was a Caribbean school that offered a pre-med to med program. And because I was so sure, and usually the process is you do 4 years of undergrad, then you stop, and we were in Canada at that point in time. You finish your undergrad, then you take the MCAT, and then you apply to med school. And that process can take anywhere from 8 years to however many years it takes for things to work out. And so we decided to go ahead and take that pre-med to med path. And it took me about 6.5 years with that. So I cut out about a year and a half. And so I went to med school in the Caribbean, St. George's University. And from med school in the Caribbean, I was there for about 4 years of my life. And Grenada is such a beautiful country. I've not had the opportunity to visit again, but I definitely do. And so from there, I did my clinicals in New York and New Jersey. And then the pandemic happened. So I went back home for a couple of months. And and now I'm here in Gainesville doing my
Wow.
resident.
That's an incredible journey, not just a metaphorical journey through all of the schooling that you had to do and the decisions really that you and your parents together were blessed and were able to make, but just geographically from Nigeria to Canada to Grenada to New York, New Jersey, and now you're in Florida and you're taking another step after this. You've matched at a program that is not any of those locations. Were those moves hard for you? Is this something that you just count as part of your story and you've used it to your advantage, or were those really difficult transitions?
That's a very good question. I would say yes and no. The initial one from Nigeria to Canada was definitely tough. I was 12 at that time,
Mm.
and I don't think I fully understood what was happening, but I knew something had changed. And having an accent, all of these things played a huge role into how I realized I was different from everyone else
Mhm.
around me. And really, just that whole journey taught me to be confident in myself, build self-reliance, adaptability as well, which I think are skills that you need in any aspect of healthcare that you go into. And so that probably was the toughest one. Going from Canada to Grenada was tough, but it wasn't too bad because I already had the skills that I built before. And so the other moves weren't too bad. I actually see them as new opportunities for growth, to meet more
Mhm.
people, to expand my network. And I always tell myself every time I've moved, it has been for something better. It's always just exciting for me to see what's coming next.
I love so much what you just said. When you mentioned that with your accent and when you move to these new places and realizing that you are different and you were growing in that confidence and self-reliance and adaptability. And I think that is what has made you so relatable. And I applaud you. And I think this is something that we don't talk a lot about, specifically in becoming a medical doctor, is how many moves there are. You might be able to tell me how many of your colleagues perhaps went to pre med and then medical school and then residency and then their fellowship all in the same location. I can't imagine that's very common.
It's not. It's very dynamic. And yeah, I don't think I know of anyone who was able to somehow accomplish all four of those stages that you outlined in one place. Very rare. So you have to be very willing and to move and very adaptable as well.
Thank you so much for sharing that story and highlighting that. That's not something we've talked about before. And I think it's one of the things that makes matching
Yeah.
out of medical school and then matching again once you're in residency, if you have the opportunity to do that. It's what makes it so exciting is that it is a new adventure. But at the same time, I can't imagine being in that position and realizing that you are about to uproot the life that you've developed right there for the last however many years and start anew, which is holy moly. That must be overwhelming. And it's just an element of what you face as a physician and as a resident. Speaking of which, tell us a little bit about what you face as a resident. You are currently an internal medicine resident here in town, and then you have some pretty exciting next steps. But tell us about your residency right now and the fact that you're a chief resident.
Yes. Residency so far has been great. The first year is always the toughest, no matter what residency you do,
Mhm.
because going from med school to the real world is just night and day. Of course, med school tries its best to prepare you for what you meet out there. What you read on the books is never what in real life. And so the first year was tough, but most people, and this is my experience as well, if you get through that, then you're set for the rest of residence. So
Mm.
intern year was hard. We do a lot of ICU, which is long hours, 12 to 13, 14 hours a day, a lot of wards as well, which is the bread and butter of internal medicine. But past that, I'm currently in my third year and I'm at the point where I feel very comfortable and confident in anything. I'm supposed to be an independent practitioner in about 3 months.
Wow.
And I feel like my residency has really prepared me for that. I feel very ready, very confident about that. In my case, I'm going into fellowship, and I believe, I don't know if it is, we've mentioned it before, but I'm going into hematology oncology, which is blood and cancer medicine. And for that, you need a good background in internal medicine. It's a backbone of hematology
Mhm.
oncology. So I feel very prepared going into it, very excited. It's been a dream of mine for a while to go into hemonc.
Oh, I bet. How did you feel when you matched into hematology oncology?
So hemonc or hematology oncology is one of the hardest specialties in internal medicine to match into. There are a couple that are a little bit tougher, like GI and cardiology, but I was shocked. I was incredibly shocked. I actually had my sister read the email to me because I couldn't open it myself. And she recorded my reaction, and it's just my jaw dropped because although, I had worked hard for this and I'm a Christian, so I've prayed hard for it as well.
Mm.
Just the reality of it and seeing all of it just come to pass and really just happen was very incredible and just exciting. I wish I could capture that feeling in a bottle and just have it at my bedside and open it every morning.
Oh, wouldn't that be amazing? Dr. Oyetoran, you have mentioned family so many times already. And of course, now you've brought up faith. And tell me a little bit about what family and faith mean to you and how they get you through.
I think that family is everything. I I take credit for how far I've come. I've worked hard for everything that I've achieved, but a huge part of that is my family as well. I have
Mm.
very supportive parents and my siblings. They've been very supportive throughout this journey, and this journey is hard to do alone. Going through medicine alone is just a very tough thing to do, and some people have to do it by themselves, and I salute them, but I'm grateful
Mm.
that had my family to lean on for support for those nights where I needed to just vent or cry or something was tough or bothering me. I could just pick up the phone, call my dad, my mom, or I have three sisters, so I could call any one of them and just talk to them. And for me, faith is the same way. I believe in God and the fact that we're here for a reason. And I think in that perspective, just going along that line, that medicine in many ways is a calling because
Mhm.
see the intimate aspect of humanity. You see a lot of people at their lowest point, and to be able to be a light in that way is just something that I hold so dear. And also, my faith has definitely supported me through this, knowing that I have a God that I can depend on as well, and that everything is working together for my good, whether it be the way I want it to or the way I don't want it to. Just having that and knowing that is very helpful.
Oh, that's so true. And even if it's not the way you want it to work out, God is still good and he has a
Right.
good plan. And I think you probably end up saying that a lot more when you're in medical training. Medicine is a calling. You mentioned the intimate aspects of humanity and being a light for some of these patients and many of their lowest points in their lives. Do you think all of this has contributed to your interest in hematology oncology? You mentioned it is one of the most difficult fellowships to pursue after internal medicine. So, you're not choosing it because it's easy. I'd venture to say you're probably choosing it because it's hard.
Yes, I that's definitely one of the big things for me. It's a tough specialty because the people who will be ending up in my office are people who have heard the word cancer and it not just being applied in some generic term, but really it being applied to them. And that word is heavy. And being somebody that can be a light and not just a light in terms of being a support emotionally, but also knowing the medicine and knowing how we can hopefully, in some cases, treat and potentially cure some of these cancers to me is just everything. That's one of the big reasons I went into this specialty and the fact that there's a lot of research that's going into it and I would love to contribute in some way. to that, to finding some sort of cure or answer for this question of cancer.
That brings me to a burning question that I've been wanting to ask you. But before I say that, I just want to highlight the fact that everybody in medicine, and probably even many people not in medicine, everyone wants to find a cure for cancer, right? But what is so difficult is being in the room with those patients when they find out the diagnosis of cancer. And that is, as a hemonc physician, that's where you're going to be most of the time.
Right.
Finding a cure is amazing. And we're always going to be fighting for those cures and trying to get those patients to that point. But so much of that time is going to be spent in the trenches with them. And I'm so comforted and I have so much hope knowing that your strength will be their strength in that time. And it takes a special person to work in hemonc. And I'm so grateful that you've chosen that career because we need you in it.
I appreciate that. Thank you for saying that.
No, it's true. So let's go back to the burning question. So you mentioned research and wanting to really impact that cure and finding that cure. Have you done research? I'm sure you have. So tell us a little bit about research you've done in the past. Has it been something that you've enjoyed? And what's next in the future of oncology or hematology oncology? What are we expecting to see?
I have done research in the capacity of case reports where we see something that is new or different from the norm. Let's say a certain cancer presents a certain way, or we treated it a little bit out of the norm and got a good result. Those type of cases we publish as case reports. Also been involved in retrospective studies where we look at, we have the outcome. Let's say somebody was on a certain medication and we look back and see what the exposure was that gave that outcome. And so those are retrospective studies, and we do a lot of them as residents. It's hard to do prospective ones or clinical trials, just given the way my program is set up and just the time that we have in residency. It's not enough time to really be able to set up for clinical trials to see if this certain intervention gives a certain results with certain types of cancer. I do enjoy doing research. I think when you can contribute something to the body of knowledge that's out there, then I'm doing something positive to affect the flow positively towards potentially finding a cure for cancer. In terms of what do I think is next in oncology, I've seen CAR T cell therapy. Right now, we have, I mean, there are a lot of immune checkpoint inhibitors that we're using for different types of cancers and getting good results with them. CAR T cell therapies, you extract somebody's white cells out of their system through their blood, and then you basically give those cells in the lab the ability to fight against cancer cells. So that's basically what is happening. It's currently very expensive, very experimental, and that's something that there are big universities that are doing trials to see if that could potentially be something that we can apply to different types of cancers or cancers that in the past have been considered uncurable. I'm very excited about that aspect of oncology.
Thankfully, dermatology, we often don't have to send many patients for chemotherapy or radiation or any of these newer therapies. But we end up talking about cancer a lot in our office because number one, we diagnose a lot of people with cancer, albeit skin cancer. But then, of course, we talk to them about other types of cancers and perhaps how they differ and how the treatments differ. Because when we tell somebody they have a skin cancer, they immediately, their brain jumps to, I'm going to lose all my hair. I'm going to be extremely sick. I'm going to lose weight. I'm going to lose my appetite, all of these things. And that likely is not going to be their story in our office. It's far less severe, but also to tell them about all of these advances in medicine. And gosh, one day I hope that we're going to look back on some of these treatments that we're performing right now and go, wow, how barbaric.
Right.
You know, how barbaric. So I am so hopeful and I'm so grateful to all of the researchers, all of the PhDs, all of the MDs, all of the PAs. I just spoke with a PA who does clinical research and she's incredible, but all of those clinicians doing the hard work so that we can present such hopeful options to our patients. I want to pivot real quick because I'm so excited about talking about this. Once upon a time, a couple of years ago, probably feels like a lifetime ago to you now, you started a YouTube channel. called Journey to MD. And I have watched so many of these episodes and they are just absolute gold. And I will link them below in the show notes. But tell us a little bit about why you started that channel and what your goal was. And is there more to come?
Thank you for watching the videos and for enjoying them. I thought about it, Journey to MD, I'm there right now, but really, I don't know
Mm.
if you're really ever there because you are always learning. There's so much new information and there's just so much to learn, and no patient presents the same way, even with the same disease. I'm still debating on if I want to keep that name or not. But yes, I started this YouTube channel back in 2020, I believe, or 2021. And basically, the inspiration behind it was there was so much information I did not know about
Mm.
being in med school or being a med student or just being in medicine in general. And because I had to learn it by experience, doing it myself or asking people who are currently in it or right ahead of me, I thought to myself that this is not information that I should just keep. This is information that there are people out there who may not have the opportunity but need the information. And so I wanted to make a platform where I could share with people what I was learning, different how to navigate certain things. I have videos up there about different rotations I did, how I figured out that I wanted to do internal medicine, how to study for step one, step
Mm.
two, the big exams that we have to do, because these were things I had to experience myself in order to fully be able to understand. But the idea of being able to help somebody that I may not even know personally, just through my videos, was to me giving back. So that's why I started a channel. And it's been a couple of years since I posted, about 2 years now, but I'm currently working on scripts and I will be back posting before June.
She'll be back, guys. Like you said, giving back, it's pride of profession. It's giving someone a look into your life that they wouldn't otherwise see. It's the same thing with this podcast. There's so much to medicine. It's overwhelming. And we hear, unfortunately, like most things, we hear so many negatives, but there are so many positives to medicine. And yes, it's hard, but yes, it's so worth it. So do you think it's going to focus on how residency has been? Or do you think you're gonna turn more towards what your next steps are in HEMONC?
I think the initial videos will focus more on what residency was like and the things I've learned through residency and what I would tell myself in intern year, knowing what I know now. And then, of course, looking towards the future as well. Now it will be real time where I can take them with me
Mm-hmm.
on this new journey of fellowship in hematology oncology. And I'm thinking of a medical Monday where I discuss some sort of medical topic that
Mm.
may have certain myths or untruths around them or just rumors and address those in short form content that is easily digestible, not using a lot of medical jargon and go from there. But I also still want it to be personalized as well. So I will definitely still be doing vlogs and just like fun videos too.
It's so geared towards education. It's geared towards sharing information with others, which is so incredible. And at the same time, speaking personally, it's a great lesson in communication for us, for you and I. You mentioned using plain language to describe some of these things. Oh, there's something that I usually say when I have in person shadows or when I'm chatting with some of our medical assistants, and it is regardless of the education level of the patient that comes in the door, whether they have a seventh grade education or they have a PhD, it is my job to make sure that they have the same understanding of their medical condition when they leave.
Hmm.
That's on me. And so
I
being
love
able to communicate is just, it's such an important thing. And I think that producing content like this, especially medical content for the masses, so to speak, is a really great lesson in communication.
I agree. What you're doing is incredible as well with this podcast. I've had the opportunity to listen to a couple of them. And I think, again, like you just said, you're communicating things in ways that other people can digest. And also for that person who's looking to go into healthcare, to be able to find your podcast and listen to it and really understand what it is that they're wanting to do or figure out what path they want to take. I think that's very incredible and very helpful.
Oh, thank you. Thank you so much for saying that. So, we have a segment on the show. It's called Quality Questions. It's where you give us an example of a question that you have been asked in an interview yourself, or a question that you like to ask during an interview, this is a great way to help us prepare for our own interviews and break down some of these questions that perhaps we might not have heard ever. Do you have one of these quality questions for us? Before we hear what Dr. Oyetoran's quality question is, keep in mind that there's more interview prep, such as mock interviews and personal statement review, over on shadowmenext.com. There, you'll find amazing resources to help you as you prepare to answer your own quality questions.
I do. I have an interesting question that I heard when I was interviewing for fellowship. And the question was, if you were a kitchen utensil, what would you be? I thought that was such a ridiculous question, but then I thought about it and I realized that I guess they were trying to figure out how well I played in a team. I thought it was a very interesting question that I was asked, and it just made me pause to think as to why that would be a question.
That's a great question. And you're absolutely right. I think thinking about perhaps why they were asking the question is so helpful in crafting an answer to that question, right? It's obviously it's out of left field, but is there a purpose behind it? Those left field questions always get me.
Right. And you have to do like oh, thank you for asking me that question because you need time to think.
So true. Oh, that's so great. Dr. Oyetoran, thank you so much for joining us on this podcast today. Thank you for your dedication, not only to education and helping others, but to medicine and to hematology oncology. And I wish you all the best.
Thank you so much, Ashley. I've really had a great time speaking with you as well. And I look forward to seeing you around.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.